Okay, so I'm Bobbi-Jo. Do you just want to start by kind of introducing yourself, share your name, pronouns, and just maybe whatever else is you feel like sharing little tidbits about yourself?
Sure. My name is Maria Fair. My pronoun is she, her, and I currently live in the Midwest, not too far from Chicago, but I'm a transplant from the San Francisco area. Um, and professionally, I have a background in conflict resolution and some mental health, several years in mental health, and also in education.
All right.
Teaching in the classroom in all different ages. Um, and then for the last many years, I've mostly been a stay-at-home mom and tried some to work part-time, and it just was more trouble than it was worth in the end.
Yeah. Well, tell me a little bit about how you kind of came to learn that you have ADHD. When did that happen in your life, and kind of what was that process of identification like for you?
Sure. Um, so I was 34, which means I made it through high school with honors and college with honors and one master's degree and half of my teaching credential and did fairly well. By the time I was in college and grad school, it was like, okay, which class this semester will I choose to be my not A, my B or my C? Because I can't do all the work for everything. And so which one am I going to do a job?
Hmm.
Um, and so somehow I managed that and doing most of the raising of my oldest daughter, um, all that without knowing that I had ADHD, anxiety, depression, those lovely things. So I had whatever coping skills were enough to get me through those.
Hmm.
And then when my oldest was in first grade at the parent teacher conference, so probably around November, her teacher said, so you might want to get her checked for attention deficit. And she said, yes, she has a lot of work she's not finishing. So, well, is it within the realm of normal? She said, no, she's missing recess every day because by the time morning recess comes, she has a stack of work on her desk she hasn't finished. It's beyond the realm of normal. Um, but whatever symptoms she had sure seemed like normal to me.
Yeah.
Um, so we went ahead and did the assessments with the pediatrician, et cetera. And she got a diagnosis and got meds. And within 2 months, she went from being in the extra help reading group to just clicking, and reading was great.
Hmm.
Um, and I said, hey, wait a minute. All the things that I just checked marked and that her teacher just checked mark as being true about Sadie, that got her this diagnosis and some meds, have always been true about me.
Hmm.
So I was already in the care of a psychiatrist who was like, well, let's try Wellbutrin and see what happens. It kind of does a little of both. We tried that, and then he added in Adderall. And I remember sitting down at my computer to try to do a writing assignment for my teacher credential program and being able to sit down and complete the task I intended to do.
Hmm.
And I was like, what? Is this what it's been like for everybody else all along?
Hmm.
So that was
Kind of your process of getting there,
amazing for me.
which is a pretty common story that I hear from women with children, is that often kids, because we've gotten better at identifying for children, kids are getting identified, and then in exactly what you described, parents will be like, in the process they're asking questions, and or they'll say things like, well, doesn't everybody do that? And somebody's like, well, no, actually they don't. um, or um, or they're like, checking those things off and exactly what you said. Oh, that fits for me. So yeah, it sounds like I'm sure there's lots of people that share your story of that process as well. How has then having the ADHD be identified impacted your life since then?
Well, initially it was the fact that meds help.
Hmm.
Um, and, and I learned, at the time I was working at a residential mental health facility. And so we got a lot of in service and, extra teaching about ADHD and other mental health diagnoses. So I was learning a lot. Um, uh, and starting to see how some of the things that how our home ran and what she did and what I did were related to the ADHD. But it was seriously um, 2 years ago now that I first heard the term executive functioning connected with ADHD.
Hmm.
So, in the whole 6 years that I was a mental health professional, um, never heard of that being
Yeah.
connected at all. Um, and so the more that I learn, even in the last couple years,
Hmm.
um, it's like I knew this much and now I know this much and I know that there's this much left to learn, you know?
Yep.
Um, I learned that this is the hard part.
Hmm.
A lot of things that I grew up believing were character flaws about me
Hmm.
are actually ADHD traits or things related to executive functioning
Yeah.
skills. And I always thought they were just character flaws.
Yeah.
I
Such a common experience for folks as well. And it's amazing when I'm working with folks who are going from not being identified to get to see that process of just recontextualizing everything in your life when you have this new information. It's really interesting. Kind of connecting with that, then, I'm curious to hear a little bit about your experience participating in mental health therapy. Um,
sure.
just for like a kind of quick overview, like brief, you don't have to get super deep into it right now, but just like, how many therapists have you had over the course of your life, or kind of what has that looked like for you?
Um, so I think we could say 7 or 8.
Hmm.
Uh, my my mom started me in therapy in 5th grade when my parents were divorcing.
Okay.
So I saw a couple different therapists in the next few years around there. Um, then there was one semester in college that I saw somebody through you know, it
On
was
campus
probably
services.
a graduate student, so through
Hmm.
on campus stuff. Um, and then in 2003, I really did write down some of the when so that
Yeah.
I could remember.
Well, that's the thing is, right,
That's why I'm looking
asking
over to the side.
ADHDers.
It's my cheat
Yeah,
sheet.
asking
See,
ADHDers to review, dates of history is not a great thing, right?
um, 2003, I was 2002, 2003. I was in the midst of a pretty abusive marriage.
Hmm.
And at one point, he said, "Sure, we'll go to counseling together." And I think that was maybe 2 sessions. And when you asked later about the unhelpful, that's the one. um, and then the next spring, 2003, I saw somebody for a little while during the process of leaving, and then he helped me transition to somebody else in the uh,
Office.
same office. It was the public one,
Okay.
local one. and then I saw her on and off for many years.
Okay.
Um, and then I don't know, maybe seven, 7 or 8 years ago, I saw somebody for a few months, and I don't even remember why we stopped, but there was that.
Okay.
And then um, my current therapist, I think I started seeing her in 2018.
Okay.
So
Yeah.
about 6 years now.
Yeah. I'm curious, of those different episodes kind of therapy, have the ADHD related traits been a primary reason for, engaging in therapy? And I understand that may be a complex question, but it's interesting to consider because, for um again, as you were saying before, there was probably lots of stuff that recontextualize and belief. So it's all deeper there, right? But I think it
Right.
is interesting for folks to know, how often when people have ADHD, are they actually, are they pursuing therapy specifically for that? Or is it other kinds of things? And then, you know, there's, obviously there's need to understand how that impacts everything else, right?
Right. Um, and at the time, I may be starting to see Jill, my current therapist, 6 years ago, maybe. Um, the other times, I would not have articulated it that way. I do remember the person before Jill. I talked with her about my ADHD diagnosis, and I remember her saying, "Here's the name of a book on ADHD in women," but I didn't have the wherewithal to go any further at the time.
Sure.
So with Jill, uh, that would be the only one where I would say that yes, the ADHD stuff was a significant part. I My kids are 21, 9, 7, and about to be 5. And so for the younger three, I did some extended nursing with all of them. And
Hmm.
so there was a chunk of 7 years or so that I was not on any ADHD meds and
Hmm.
was on, and there was good chunks of time in there that I was not on anything for the depression, anxiety either.
Hmm.
Um, and so I was like, listen, hon,
Yeah. Do you,
I
because
gotta
I,
go. I
I,
gotta go talk to somebody so that we don't all.
yeah. And since you brought that up, I think that's a really important thing that, a lot of times folks don't think about the impact of that, right? For women who are pregnant and nursing. And,
Mhm.
of course, everybody makes individual decisions with their providers, but generally the recommendation is to not be on any kind of stimulant medications when you're in those situations. And so,
Yeah.
I guess, what did you notice during those times for you in terms of those ADHD traits?
Uh,
I know it's hard to pull apart because you're also dealing with all the rest of the, pregnancy and postpartum hormones that are happening, but
yes. So whatever coping skills I had gathered to get me through ADHD and parenting and school, and being a professional, were not sufficient for having 3 little ones.
mhm,
And, I always, ever since my first daughter was born, had kind of wanted to stay at home and get to be with my kids rather than feeling like I had to work.
mhm,
Um, and so I had really been looking forward to that. Um, however, the the expectations, sort of the more traditional expectations of the female mom stay at home, uh, include a lot of things that are really hard on somebody with ADHD,
Yeah, just
like
tons of executive functioning.
cleaning,
Mhm,
organizing, having the energy to make sure dinner's ready on time every day,
mhm,
routines, bedtime, and more cleaning. And,
mhm.
my husband could not understand how I was home all day and yet the house was still a disaster.
Yep. And that's one of those things
And
that is often true for all stay-at-home parents, just because, actively raising young children takes far more energy than most people realize, right?
yeah, yeah,
And when we add in the ADHD, though, that, to be able to manage that and the schedule and all the things, it just adds this huge
yeah,
additional layer of difficulty as well.
yep. Um,
You also, I just want
so
to name that you made a really important point there before, of something, another trend that I often see is that you sound like you're somebody who had enough, if you will, kind of coping strategies to a point, and then something happened in your life. In this case, it was probably additional children, and maybe the shift. That's the other thing too, is that shift
mhm,
from work has a pretty clear schedule, right? Where you are then responsible for fully scheduling yourself and your kids all day. And so then
mhm,
sometimes there's just this like invisible line that, particularly for many women, that they cross, that perhaps the ADHD traits were, quote, manageable ish, you know, um, up until a point, but then it feels like it is no longer. And that gets really confusing for folks because, for
mhm.
one, you don't always have a
Right.
clear reason, but it's important to name that that is very much a thing, that, and it's often a big transition, either high school to college, or children, or sometimes even, number of children. I mean, for myself, I have two kids. I know that, I was diagnosed shortly after, grad school, and it was a lot about that. Like, the way that I managed is I just filled my schedule so full that there like was, if I didn't want to do something, I could look ahead and see, well, if I don't do it now, I don't have a space for the next 4 days. And so that was how I created motivation to do
Uh-huh.
things. um, and so when I moved into having work, that I was semi responsible for my whole schedule there, and then had, however many hours at home to myself, then
Mhm.
I had to structure that time as well. And that's when I really started to notice things. And then things, I will say, have become progressively more noticeable as I had each child. Um, so your story, just want to
Mhm.
name that as well, because I think it's
Yeah.
a really important piece that, is something that, sometimes people will be like, well, you can't just get ADHD all of a sudden. And outwardly, it might seem that way,
Mm.
but usually once we have some retrospective look, there were traits, but there might have been enough coping strategies that they weren't having
Yeah.
as significant of an impact, that it was super, super clear earlier on.
Right. Um, the another huge factor was expectations,
Mhm.
internalized expectations.
Yeah.
Um, I I like to say I have a cross-cultural marriage. Um, both my husband and I are very white American Christian background, whatever. But I grew up just outside of San Francisco, and my high school teachers were people in Berkeley. And so, and I have my mom is a pastor. My grandma went to seminary in her 70s and became a pastor. So, um, we're more progressive. And my husband grew up in central Illinois on a farm on land that has been in his family for over 100 years,
Mhm.
as one of seven farm boys. And he said, in their church growing up, the men and the women still sat on separate sides of the room. And so his expectations of what it would be like to be married and have his wife at home with the kids were very different than what I thought things should be, but still some of those internalized, this is
Yeah.
what the mom at home should take care of, sort of expectations that were not at all realistic or helpful
Yeah.
for
Probably
me,
once again for
particularly
anyone,
for
but
my mental
also,
health.
yeah, for anyone, but then especially for somebody who struggles with executive functioning and probably gets overstimulated by their children's noise and all those things.
Yes. And
um,
so the other exciting part of my family, I think I've commented on your posts before, is that all of us are ADHD
mhm.
in this household of 6 people, 5, sometimes 6, depending on whether my girl's at college or not. And my husband doesn't so much believe in mental health and medication for such, and just try harder and make it happen.
Yep.
So he is, of course, undiagnosed and untreated, which leaves all of that for everybody else, for me to manage
Mhm.
and advocate for, and do it despite knowing I'm going upstream.
Yep.
So I often feel like I'm doing the executive functioning for 6 people.
Yep. Yeah. And it is a lot of
And I don't
pressure.
even know how to do it for me, really.
Yep. Yeah. It's a lot to manage. And that's what how I always frame it when I'm talking with folks is, I went from managing one human's life to having to track and keep, all of the things for other human, additional humans' lives.
Right.
So it's a big shift and adjustment when you're already struggling with one, right? Um,
Mm-hmm.
yeah. So with your experiences with therapy, have you had any experiences, I mean, kind of particularly, if they're ADHD related, but could be generally as well, that were not helpful or kind of unaffirming?
Well, I mean, one of the things is that, if I've seen 7 or 8 therapists, um, none of them noticed or identified ADHD as being a part of what I was dealing with,
Yep.
um, which is in the category of not being intentionally or overtly harmful, but not helpful.
Yep. Yeah.
Um,
Just the missing it piece.
and I really think that that was a gap in their knowledge.
Yep.
I'm assuming,
Hmm.
is seems to be the logical assumption there. And my my current therapist is a very nice lady and has been very helpful in telling me I'm not crazy, that this is stressful, sort of
Yep.
thing. Um, and being someone who I could vent to, but has not been able to offer me any insights or wisdom or strategies as far as the ADHD.
Okay. Yeah, which is again probably a just a knowledge gap, which is pretty typical. Um,
Mhm.
and that's part of the reason for doing these kind of interviews is in providing resources for therapists to kind of
Yep.
really get to see some of those impacts and how that works out. We just don't do a great job top down. I mean, doctors, psychiatrists, psychologists, therapists, et cetera, of providing education about what it really means to have ADHD. And so obviously if those people don't have that education, then they can't pass it on to, their clients, right? And so many people's experiences are kind of much like yours, where, okay, you have ADHD, here's some meds. That was my experience as well, even while working as a professional, right?
The
And so,
the very helpful thing,
mhm.
uh 2 years ago, my son, my
Oh, I think we had a disconnect here.
Okay,
1 second.
your picture froze.
Yeah, it froze there first. I think we're back online now. No, seems okay. Can you hear me
Okay,
okay?
I can. It says my internet connection is unstable.
Okay.
I don't think I can fix that.
I think it's
Um,
back now, so
okay.
hopefully it won't continue.
So 2 years ago, um, my son was in second grade, and he was already on ADHD meds and on an antidepressant. Um, but he made an attempt to kill himself at
Mhm.
7. You know, oh my goodness. I called and talked to the pediatrician. Was like, okay, who do we go to? What do we do? And he's like, well, we don't really have, a psychologist we refer people to, and he ends the phone call, I kid you not, by saying, good luck with that. This is my 7-year-old. This just happened. How can you say good luck with that?
Mhm.
But we did find a place in Chicago that did partial hospitalization programs and had other programs. And their team, including the psychiatric nurse practitioner and the therapist, etc.,
Mhm.
um, are the ones who first introduced us to the concept of executive functioning skills
Uh-huh.
and deficits in that being a part of the ADHD.
Yeah.
And so their input is what started me looking for more information about executive functioning skills and how that fits in with ADHD.
Mhm.
And so if he hadn't gone there and those folks hadn't given us information about that, about executive functioning, I might still not know that that's a part of what's
Happening with
extra
the picture.
hard in our lives.
Yeah. Yep. Yeah, that's one of the big barriers, right, with the current diagnostic criteria is while they hint at difficulties with executive functioning, they don't really specify those kind of things. And so then, again, it just seems like it's all attentional or, that you just need to focus rather than understanding there's a lot more to it and all those pieces that are there. And so, um, or giving more direct kind of feedback on how to manage all of those pieces. So, yeah. Are there, when you've worked with your therapist, thinking about just kind of like your natural ADHD traits, and those present differently for everybody, but often we can have different kinds of, processing styles, and our thoughts can be, more scattered and come rapidly or things like that, which can sometimes be difficult to have other people follow and understand. And so I'm curious about, when you've worked with your therapist, have you felt like you could just be yourself and present, or do you feel like you have to kind of mask all of that and try to make it, work for, help the therapist understand? Or do you feel like you can just allow yourself to go where your brain goes and say what you need to say?
Well, um, I've so on the one hand, I don't think I've learned yet when to identify when I'm masking.
Mm-hmm.
So
It's
there's
hard to say.
that.
Yeah.
Um, Also, you know, she's one who tends to start the session with, so what's, how are things going?
Yep.
And then we're just off and running.
Mm-hmm.
Um, which also means it feels like we don't ever actually work on anything.
Mm-hmm.
I just tell her how it's going for an hour, you know,
Mm-hmm.
and show her pictures of my kids and my cats. And
Yeah. And sometimes
um
that's helpful, and sometimes it's hard to find the connecting point
but
or
there
get to
could
the
be
deeper
more.
things.
There
Yeah.
could be more.
Yeah. Yep.
Um
And that's I think that tends to be a a style thing, right? Like different therapists have different kind of approaches and styles. Some are more directive, some are more client led, and so they really just follow wherever you go. Um, and so, in my opinion, and training other therapists, I'm working with adult ADHD. There isn't necessarily a right or wrong there about the right approach. It's really about attuning to the client and what is it that they need right now in this moment. Because, my experience has been sometimes the most helpful thing, sometimes people just need to verbally process because they don't have others to do that to. Other
right.
times they do need to go deeper and
Mhm.
really do some more inner work. And that's the most helpful thing. And so, yeah.
One of the things we um did talk about quite recently is I would like to get a workbook for us to work through together
Mhm.
um, on executive functioning or ADHD or something like that. And
Mhm.
actually, contacting you was on my to-do list for a while to see if you had recommendations for um, a helpful, affirming workbook.
Yeah.
Um,
And I can talk to you a little bit after if I'll ask you a couple follow-up questions to make sure you get what exactly it is that you're looking at, because there's some that are more executive functioning focused, some that are more, um, more like internal processing kind of
mhm.
focus type of things. But yeah, there are some good tools that are out there. Um,
So, um, so that's in that way she was responsive to.
mhm,
She's like, sure, let's get the workbook and do it.
sure.
Because I know if I have somebody, the accountability of
Hmm.
going through it with somebody, um, for me would be the difference between it happening and it not happening, you
Yeah, for
know.
sure. Yep, that makes sense. Is there any kind of accommodations? And I'm thinking just broadly, right? Like in a kind of a perfect world, it can be realistic or a dream world. Any kind of accommodations related to your ADHD traits that you would want from a therapist or would make accessing therapy um, more helpful or more, more accessible or easier for you?
Um, I mean, little things like the the texted reminders of appointments are very helpful,
Hmm.
you know. And when I was looking for therapy and psychiatry services, one person that I was referred to, I think it was for psychiatry, was like, well, I don't take insurance, but you can submit it yourself. Like, no, 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 no. See, the thing I need to come see you about is the fact that I can't submit paperwork myself.
Yep. Yeah.
Gonna have to look for someone else.
Yep.
Um, because I know it just won't happen,
Yeah.
you know.
Absolutely.
So when
Making
and I
the so
get that
making
there's
so
a
some
whole
things
lot
are.
more to being to insurance than
Yep.
that makes it hard for providers to necessarily offer that.
Sure.
But for folks with ADHD, it makes
Yeah.
an all or none difference.
Yeah, so just making
Um,
sure that those processes for using insurance or billing and all those things are as easy and the less amount of steps as possible.
mhm. um,
I know I just found out after some time, I don't know if it was a new feature, but that my therapist's office, they could keep my card on file. But until then, they hadn't told me or didn't know that. So I had to go in
yep,
every time and pay.
yep,
And
mine
like that's
does.
been life. Like I know what you're going to charge me, so it's not a concern, right? And so that's been great because now I don't have to keep track of those things and deal with them.
um, there have been times when, I was overwhelmed by the to-do stuff.
Hmm.
And my therapist has helped me write a list and said, okay,
Mhm.
you need to email this person. Shall we do it now?
Yeah.
You know, and well, let me get a couple phone numbers for you. Uh, some of that concrete stuff
Mhm.
is helpful.
Yeah, absolutely. And that's again another recommendation I often make is just on some days at least, right? Like
Mhm.
sometimes doing the things that will alleviate things off the to-do list, like, oh, I have
Yeah.
to send this email, but I don't know what to say. Do you want to
Yep.
go ahead and write it right now? Getting that off some
Right.
people's lists can be the most helpful thing to free them up.
Yep.
And that like support and accountability, to just take care of it sometimes. And
Mhm.
and I think it's important for therapists to know that might feel like you're not doing much. Um, but it
But
actually
it
is
might be
sometimes
the
the
thing
most
somebody
helpful that's
can't,
needed. Yep.
right? It might be the thing that I can't do.
Well, you're directly supporting executive
Right.
functioning challenges,
Yep.
and so it is very helpful. Um,
Yep.
is there any kind of messages that you would want to share with therapists about how to best support somebody with ADHD from your perspective?
Um, I really wish that these wonderful, experienced, kind, and wise therapists knew more.
Mhm.
Um, that when I say, I'm hearing that executive functioning skills is part of this, that they would have some research instead of saying, oh, you know,
Mhm.
that
Yeah.
they would know more about what it means to have ADHD,
Yeah.
and um and have some resources that I don't have, and some skills and strategies that I don't have. Um just even if it's, hey, Lisa down the road is going to do a workshop on executive functioning skills for parents, instead of me being like, here's the resource list that Bobbi-Jo put on the internet. Here's Lisa's, So right now I feel like I'm helping to educate the therapists in my life, which
Mhm.
I don't mind doing, but I need help from them, So
Yeah, it would be nice to not have to put that extra work in and just kind of, again, take one task off your plate and have those things, provided to you or for you. Mhm.
and the fact that, I'm about to be 50, and I'm just starting to learn this stuff. And, you know, none of the therapists that I've worked with, even at a residential treatment place, have known or been able to share this information.
Mhm.
So now that it is increasingly available, um, I really hope that therapists will take it upon themselves to get educated on the new information so that they can have the resources,
Yeah.
because they might be the only place, them and TikTok, right, are
Right.
the only
Well,
places that people are going to find it.
yeah, and while the other thing I think that's important is I know often, people will say, well, find somebody who specializes in it, and that's great. And sometimes there's other, people live in different areas, insurance resources, people are limited, right? And so it sounds like your therapist is at least, doing the current one is at least doing those, like being open to what you are bringing and things like that, which goes a long way too, right? It's better. There are
Right.
also some who are directly unaffirming of, like denying and kind of
Yeah.
diminishing those things. Um, but yeah, there's a lot of times that there are folks who are in limited resourced areas. And so,
But
you know,
finding somebody who specializing in it, like almost all the therapists therapy practices on their webpage, the people list ADHD, right?
mhm,
And so there isn't a way to know who
yeah.
actually specializes in that.
Yeah, and it is really tricky. I did write a while back, I wrote a guide for finding a neurodiversity affirming professional, that I tried to
Mhm.
pick up on some of those nuanced things, but you're 100% right that, yeah, most people check the box, but don't.
Mhm.
And here's the difficult thing. Sometimes they think that they know how to help, but they just don't
Right.
know what they don't know. And
Right.
so, yeah, and
Yep.
so it's so yes, you might have experience working with people with ADHD, but are you actually fully understanding it and knowing how to support them is a different thing. So for those looking,
Yep.
it is really challenging to be able to clarify all of that. And so, and even I will add there's some nuance too, even if you use some of those things in the guide, there's also people that are smart enough to know what language is trending.
This is pumpkin.
Oh my goodness. That know what language is trending, and so they'll use it, but they haven't really done the
Mm,
work to fully understand what it means or how to do that. And
yeah.
so even telling people to like look for certain language on a website in and of itself doesn't always indicate kind of level of competency around that. And so it is really a difficult thing. And just as with any issue, anybody can say they specialize in anything. Um, and so it's hard, and often those of us
Mhm.
who do say that, like, I am somebody who I don't like expert and specialize because I know I don't know everything, right? And so I'm uncomfortable with that, and I've had to have lots of colleagues tell me, like, "You do know more than most people, and so it's okay." Um, and so there's also that too
Mhm.
of sometimes the people who do know don't are scared to put that out there, or that feels too kind of permanent, even though they probably really do have a lot of knowledge in certain areas. And so
Mhm.
yeah, it's a real challenge that exists. Is there any kind of just one or two strategies that you've picked up from wherever, just on your own, that you figured out that work well for you, that's kind of been a game changer that you just want to share? Because I think it's good for therapists to hear that, or any other fellow ADHDers that might see this.
Um, oh, there's a few that, so my first thought is I'm still searching for those.
Yeah,
Um,
I would
there's a
probably
few,
challenge that. My guess is you have a bunch of things, systems that you're using that are working for you. You just might not even know that's what you're doing is using a system.
yeah. Um, I mean, I have the morning steps and the bedtime steps in the little slip charts for the kids, and
Mhm,
that makes a huge difference. It only took me a year of saying, I need to put those on cards in a, I need to post the schedule with pictures so they can see.
mhm,
But we finally got it done and it does help.
mhm,
Um, Body doubling,
mhm.
um, just having somebody else there to be like, hey, you were going to clean that up, right? Let's work
Yep,
on this today.
yep,
Um, is again a strategy that I don't use nearly enough.
mhm.
Um, but I've seen it be very helpful when I have.
Yeah,
Um, you might not think of it, but meal planning. Um, Honestly, even if I just write down what will be our main dish each night for the week, doesn't matter if I end up, come Tuesday afternoon choosing to do Thursdays instead.
mhm,
Um, by the time I should be getting ready for dinner each night, the decision fatigue is
mhm.
running real high.
Yep,
And all I can think is, if I make that, Tabitha won't eat it. If I make that, Peter won't eat it. If I make that, well, I didn't thaw the meat for that, you know. Um, and that one we had to recently. And so I can send you a picture. I should have grabbed it. I sat down and made 5 weeks worth of menus without repeating that each, I made a list of beef, a list of chicken, a list of veggie, and a list of pork entrees, main
mhm.
dishes. Side side dishes, we can have, mixed veggies from the freezer to the microwave every night. I don't
Yep,
care. Um, and then I can pick one of those weeks, and it just means that the deciding no longer has to take up a bunch of energy and
yeah,
stress.
yep. Yeah, it sounds like, and that's a great strategy you can use in different kinds of areas too, of having choice lists, right? So you've at least like a, so instead of I can choose from any meal in the whole world right now, you've already eliminated it down to a certain amount, it sounds like. And then it sounds like it's also helpful because once you decide those meals for the week, even if you shuffle them, you
Mhm.
probably then are then making sure you have the ingredients that you need to make all of those things, so that doesn't become another potential barrier for you. um
Yep.
and so yeah, and I it sounds like you also have some flexibility with that, which is that's exactly actually what we do in our house. Is the kind of end of the week, we talk about what we want to have. We don't necessarily choose, for us, we don't always choose a specific day. Sometimes there's some that like make sense based on time and our schedules and whatever energy or whatever. But and then we always make lots of leftovers too. So a couple nights a week we will just eat whatever's in the fridge and everybody can choose.
Yeah.
But yeah, so that works well for us because then there's some flexibility that like this doesn't really sound great tonight, or I had a rough day and I'm not up for it. We can shift a little bit, but we've got enough prepared that we're good. So
Another thing would another seemingly little thing is that all the containers must be clear.
mhm,
Um, you know, clear storage bags or bins for clothes, for food, for toys. Everything has to be see-through or it doesn't exist anymore.
yep,
Um, that one makes a huge difference.
mhm,
Uh, and what else did I write down? Um, I am wanting to learn and try time blocking.
mhm,
I have seen how amazing that's been for my oldest daughter who's in college.
mhm,
Um, and I can see potential in it again because of the decision fatigue. I remember you wrote a post about that recently, and I was like, yes, can I show this to everybody? Um, just, I have 20 or 30 minutes. What do I do with it? Oh, it's gone. you know?
yep. Yeah, yeah, which kind of goes
Um,
back to that other thing. If there's different, that's a strategy that, what you said you were doing with the meal planning and the categories, that's something that is helpful. That I will often recommend too is like just start actually time yourself doing like recurring household tasks and put them all to start with. Just you don't have to do anything more, just put them all in a note. And write down what it was. Let's assume it was an average productivity attention kind of day, right? Maybe you need to do it a couple times and average it if your productivity is vastly different, because again, we don't do a good job of accurately estimating how long things take. And it's also usually the things that are hardest for us, we estimate that they take way longer than they actually do. And the things that we enjoy, we usually underestimate how long they take, right? And so once you've got that, if you start adding more and more items to it, you can separate it out of here's things I can do in 5 minutes, things I can do in 10, in a half hour. And then let's say I have a half hour block open sometime, I can know that I can reliably start and finish this one task in this half hour. And, just pick one of the five things in that category or something to work on. And so, yeah, I mean, of course, you can do lots of variations of that too with whatever works, but having, yeah, those ideas of here's a list of choices within this time or this amount, that can be really helpful. And it crosses over several executive functioning skills at once, right? Of like time management, time perception, uh, planning and organizing, prioritizing. Um,
initiating.
it also sometimes that option is also good for folks who, some people have kind of if they are too scheduled, like
Mm,
time blocking specific tasks is too much of a demand and then they can't do it because it feels like a demand. And so instead,
mm,
if you made that category, you can just put on the time block like 30-minute task and then pick one of
mm.
the things from the list rather than saying, I will
Okay.
specifically do this. And so it doesn't feel like as much of a demand because you still get some choice in the moment.
Yeah.
But at least you're still doing something, that's helpful. And So it's like a variation on that. Because I will say that's the one downside of time blocking. Some people, when they're really specific, their nervous system is just like, nope, I'm not doing this right now. Um, so sometimes having a more generic category of that with some choices works for some folks in that scenario.
Yeah.
But yeah, it sounds like you've got a few good ones that are working well, and those are all excellent ones that I find myself recommending frequently. So um, I don't have any more questions right now. Is there anything else that you really wanted to share that feels important?
Um, see, the other thing that I had put down that's not really a strategy, but in the last several years, I've heard several people talk about ADHD as a superpower.
Mm-hmm.
And think finding, the benefits of the ADHD is still pretty hard for
Mm-hmm.
me. Um,
Yep.
the and um so being able to articulate what the benefits are would be really helpful.
Okay. Yeah, I think it is that the superpower thing is often a hot button issue for folks in the ADHD community because some people, and personally, my approach is to try to be kind of middle of the road, right? Like, I think there's lots of things that we have as strengths and that are unique and are helpful. And sometimes
Mhm.
people use that superpower phrasing in a way that feels kind of like that toxic positivity and it feels
Mhm.
dismissive of all of the real challenges. And so I think it always has to be done in a balanced way. Um, and there are lots of strengths though. And so, yeah, it definitely is helpful to have some of those strengths pointed out to you or to be able to identify them and also not diminish the
Right.
challenges that exist at the same time because both can
Yep.
exist concurrently.
Yep.
And so, yeah, I think that is a good thing. And again, everybody's experience with it is different, right? Some people don't experience that one strength that other ADHDers may have just
Mhm.
for whatever reason, right? And so, um, yeah, it's a hard process, but that's definitely a good thing that can be helpful again for therapists to be aware of too of trying to help find some of those strengths in a way that also doesn't diminish
Mhm.
the real challenges that exist as well. So,
Right.
yeah. Well, I really thank you for your time. I appreciate your
You're
willingness
welcome.
to share and your vulnerability and sharing your experiences with others so they have that opportunity to
Certainly.
learn from your lived experience. I'm gonna
Thank you very much.